Health, and apologies for the typo. This one's meant to be a professional-led discussion. So first up, I would like to begin with an introduction to autism awareness. First off, defining what is ASD. It is autism spectrum disorder, and it is defined by the Mayo Clinic as a condition that's related to brain development, and it affects how a person sees others and socializes. Includes Asperger syndrome, which is on like the milder side of the spectrum, PDD-NOS, which stands for pervasive developmental disorder, not otherwise specified. It includes autistic disorder, which is also known as classic autism, Heller syndrome, aka childhood disintegrative disorder, or CDD, and it is the most rare and most severe on the spectrum. Now, these conditions used to be referred to separately, but in 2013, the DSM-5 combined all these under one singular diagnosis, and that is ASD, which is by separate autism spectrum disorder.
So, actually, in ASD, there is a spectrum of different types of autism. So specifically, level one requires some support, but there are still more functions, or level one usually just requires some degree of a support, whereas level two, people on the autism spectrum tend to be more distressed easily with sudden schedule changes or interruptions, or even sensory overload, whereas level three is usually on the further end of the spectrum. So people on the level three spectrum level would usually need a lot more support when it comes to communicating with others at school or in public spaces. So,
Next topic is ASD and mental health, which is our topic for today. To preface, I want to remind you guys that ASD is not a mental health disorder. It is a neurodevelopmental one. Nevertheless, it has a connection to mental health. There is a study done in the UK in 2022 that found that ASD populations have higher rates of depression and anxiety, and I have like the numbers here, 8% and 8.8% more than the general population, respectively. And the study attributed that increase due to stigmas, a lack of understanding of the condition, underemployment, and the psychosocial effects and experiences of development as an autistic individual, which are known to be stressful. Our goal in this webinar is to tackle the first two factors, and we are honored to be joined by Dr. Maria E. Johnson to help us in this aspect.
thank you so much to Dr. Johnson for joining us today at this webinar. So, Dr. Maria Johnson is a board certified psychiatrist with over 20 years of experience with ADHD, bipolar disorder, trauma, depression, and PTSD. And thankfully, her special interest in autism spectrum disorders is what really connected us to this wonderful webinar today. And wow, Dr. Johnson has led over 40 clinical trials, also mentored future clinicians, and also explored the frontiers of psychiatry and psychopharmacological research. It took me extra brain power to process that, so that's really impressive. And she even edited this book. It looks so cool, called The Asperger's Disorder, published in 2008.
And now we send the stage towards Dr. Johnson.
Hey, hello everyone. I'm glad to meet with you today. I'm actually really excited. I really enjoy working with high schoolers. And as Grace and Emily described, I have special interest in autism spectrum and have edited a book on Asperger's disorder, which was terminology that began in the 1920s when Hans Asperger wrote a description. And then the term they kept using the term Asperger's disorder for some time to describe high functioning people with autism, but then they decided that it was really a spectrum and it would all be classified as autism spectrum. Okay, and we're going to give a talk on mental health and autism spectrum, and I found some cool things that I want to share with you all. Let me share my screen. Okay, and there's a screenshot of my book that Grace and Emily have shared. And this really, we looked into, I was very curious about what are the causes of this. And I really did a deep dive into the information that was known at the time. That was back in 2008. And we've learned so much since then. It's really been an odyssey. And medical science is just, exploding with new developments left and right. It's very exciting. Okay. And so I'm going to go over your DSM-5 criteria. I don't know if any of you guys are interested in going to medical school, but in medical school, you have to memorize extremely large volumes of material. And for example, can you guys still see me as well?
Yes, we can see you.
Okay, great. So for example, this is a pocket version of the DSM-5. And the autism spectrum criteria has, all this detailed language of, it's very detailed descriptions of these different categories. And sometimes you can get lost in the weeds there and have trouble grasping the big picture. And mnemonics really are extremely helpful in memorizing and retaining information. So I came up with this one for the autism criteria. And the two big things to remember are social impairments and another section which is called restricted or repetitive behavior. That's the two big categories. And then you always have to remember too, with DSM-5 diagnosis, they always put a little number, a little criteria that this must impair the person's functioning. So if somebody has these traits, but they don't have any problems with it, they're perfectly happy, you don't really, need to necessarily diagnose a condition. So that's part of the psychiatric threshold. But if someone's coming to see me, that's because they're having a problem. So we have our mnemonic REC RENs. So in the social category, they give three big sections. And so the R stands for reciprocity. And you can see this with people on the spectrum that they have a really hard time speaking back. Like if you say, call them on the phone and say hello, they'll just sometimes just sit there and say nothing. Or they just don't have the normal back and forth social behavior. And, part of this is that the symptoms also have to be present from early childhood. So, and you'll observe this in children. The E stands for expression. And this is decreased nonverbal behavior like eye contact, gestures, facial expressions. And I have a case study I'm going to do later in the presentation with one of my example patient who always his whole life had serious trouble with eye contact and had to look at people's mouth instead of their eyes. And that's a really common coping technique for that particular symptom. And the C stands for connections. And the question is usually, do you have a best friend? Do you have a partner? Are you close? Do you have, a group of friends? And they tend to have a lot of difficulty making these kind of connections. All right. And then the next big category is RENs for the restricted repetitive section. So the four choices there that they must have at least two of these. And the social category, they have to have all three. So the repetitive behavior, this will be like tapping on things, playing with a pen or saying the same thing over and over. The I stands for insistence. And this is where they are distressed by change. They get very upset if their routine has to change or if something changes in their environment, if there's some transition in their life as well, like changes like moving or any loss of a family member or things like that are extremely difficult. The N stands for narrow interests, and this is a really amazing part of autism spectrum because they really have a special superpower in their ability to detail everything about and remember everything about so many different subjects. Children will commonly be obsessed with trains or Thomas the Tank Engine or Pokemon or geography. So or weather. So it's really fun. And as they get older, they may have other special interests. They always usually have something. And then the last category, which is a really difficult one for people with autism to cope with, are the sensory system symptoms. And these are part of what can help create trauma for people on the spectrum, like things that neurotypical people can tolerate. They may find it unpleasant, but it's not, harrowing or terrifying, such as being exposed to loud noises, chaotic environments, crowds of people, but even fluorescent lighting, loud sounds like fire alarms will really, really upset them. And it just makes their everyday life that much more difficult. Moving on. The reasons why, and as Emily and Grace mentioned, depression is more common in people on the autism spectrum. And the reasons for this are that because of their social impairments it seems they're basically their nervous system is different to where social behavior does not come naturally. They have to learn like how to talk about the pleasantries of life, like how to say, the weather's great today, how to talk about like these kind of useless things that we do to kind of interact with each other and bond with each other. They may do great on sharing information, but they really understand. So they do this thing called masking, and they will hide their traits so they can fit in. And this is very exhausting. And it also kind of makes them feel invalidated, like who they really are is not acceptable. Other big contribution is feelings of loneliness and rejection, which one of my case studies also experienced intensely. Actually, both of them reported a lot of loneliness through their life. People tend to, they be excluded, they can be bullied. And as we'll speak on in a couple slides, they're more likely to experience trauma from things that other people may not consider traumatic or as like life-threatening. And also the bullying and stigma kind of ties in with the loneliness and rejection. Let's see here. Okay, sensory overload, as we mentioned before, we'll have a whole slide on that coming up. Autistic burnout. I see this with a lot of my patients. I had a very brilliant university professor who, was kind of being overworked, and especially with the pandemic, she was having to teach virtually and in person and kind of being, once again, taken advantage of by people. This is really common for people on the spectrum because they don't understand like hierarchies, and they will trust people who shouldn't be trusted. And then they'll be taken advantage of. And this happens a whole lot. And so like, for instance, she was just working like 12 hours a day for weeks on end and not getting her needs met. And she would end up in basically a catatonic state where she couldn't even get out of bed or speak or anything. This is extremely distressing to her because work was so important to her. And finally, this whole chronic misunderstanding. People you guys have probably felt this. It's very upsetting when someone says, "Oh, you think this way," or "You don't know this," or, "You're this type of person. You're too sensitive. Stop overreacting. It doesn't hurt." When in their perspective, because of their sensory overload, it does hurt to them. Like itchy clothing, tags in clothing, certain fabrics, certain textures of food actually are extremely distressing to them because their nervous system is more sensitive. And now we'll go to our trauma slide. Actually, we will go to our autism and anxiety symptoms slide. So that was so anxiety is extremely prevalent in autism as well, and it's you do see like it's almost part, even though it's not listed as an autism specific criteria. The rigidity and the need for routine is a big piece of anxiety for people with autism, as well as social rejection, but or just being overwhelmed in general. So we have some awesome techniques that you can help your friends with, or and you know, neurotypical people with ADHD. A lot of people can find these types of things helpful. So, and a lot of times you'll see people on the spectrum wearing ear protection. That's extremely important to due to their sensitive hearing. Sunglasses, light controlled, blackout curtains, turning off the overhead lights and using lamps instead can be very helpful. Comfort items, soft objects, weighted blankets, and I have my comfort item right here. I wanted to show you guys. This is Fluffy, and he's a wonderful comfort item. He's very soft, and people on the spectrum do love animals. And I'm going to talk to you about a very famous figure in autism at the end of the presentation, who was an expert in animal care and communication. Okay, the STEMs, as we discussed, one of the main criteria is that they have this repetitive behavior. So it can be really helpful for them to have like something small that they can sort of fiddle with to help relax them. Having a routine and kind of sticking with it is very helpful. Sometimes autism people on the spectrum report trouble with time perception. So having alarms to help you remember, like, I have this much time left before I have to go to school or work. And number 7 is extremely important. As we talk about this trauma from being sensitive in this world and being different, the body actually will kind of store the trauma in the body. The sympathetic nervous system is basically the 4 F's. So when you feel threatened, you will either it's fight, you'll have a desire to fight, flight, or run away. Freeze, people will completely freeze up, sometimes disassociate when terrified. And fawn. And fawn refers to like kissing up to people, basically doing whatever other people ask you to. So a really wonderful thing to do is just to shake your body, dance, run around, and shake. And by shaking out that that energy gets stored in the body. And, you know, for example, in nature, if a mouse is terrified, it runs away. And by the physical exertion, it sort of releases that kind of toxic stress energy. Another good thing, if a person with autism is feeling extremely anxious, you can kind of guide them to say, okay, well, you know, what's going on? And what anime have you been watching lately? What's going on there? And they can find it very helpful to distract themselves because they get so much pleasure out of their special interests. Number 9, the time alone, that comes back to that burnout symptom and the masking that they have to do. So by kind of just going off by themselves and kind of separating themselves in a quiet place, helps them like rejuvenate their mental energy. And then another great is number 10 is awesome as well, extremely important. Self-acceptance and a support network who understands you makes almost all the difference in the world for many people. And as high school students and teenagers, you guys are going through a developmental stage where you're actually defining your own independent personality. And at this stage, you tend to turn from your parents' belief system and decide you want to develop your own. And then instead of looking to your parents, you look to your peers. And it's a very instinctual thing. You see it with kids all the time where they're just obsessed with their friends. And so having that support network is really extremely helpful. And the self-acceptance piece is really key for all mental health conditions. If you have some condition, by feeling ashamed, feeling guilty, feeling less than, or criticizing yourself is going to make it worse. So by accepting, like, I have this condition, I'm still a wonderful person. And something I always talk about with all my patients is that diversity is a really beautiful thing, in that we're a tribal species. So we succeed when we work together. If we were like left in the wilderness by ourselves, we will surely die. But if we have a group, then each person has their own special talents. And people with autism spectrum have some really, unique special talents that we can all benefit from. Okay.
Hi,
And
sorry to interrupt. I'm so sorry for interrupting, but I thought it was a bit related to the earlier topics you were talking about. But Jasmine
uh-huh,
had a question earlier
uh-huh.
asking how can people identify the difference between autistic burnout and depression? Or how would you say autistic burnout and depression are interconnected? I think that's a really great question, so I wanted to bring that up, if that's okay.
Yes, it is. That's a great question. And I've actually gone through this with many of my patients. And that's where, like, being an autism specialist really helps here. And that's another piece that, I wanted to share, that many providers will not diagnose autism spectrum. They don't understand it, and they'll basically, just neglect to even explore it, and they'll go straight to major depressive disorder rather than autistic burnout. And then the person will get treated for that, but it's not really the same syndrome. So that type of treatment may or may not be effective. However, the autistic burnout is very related to, like, the environmental stressors at that time. And it's a different where they just can't, like, their mind will not even allow them to, like, sort of communicate. They're totally impaired with their communication, and they may feel sadness, but it's more of it's a different cognitive experience than depression, which is a deep sadness, a deep, thoughts of death, extremely low self-esteem, changes in appetite. It's the autistic burnout is um, it's really a different syndrome. And by understanding, and sometimes in the same medications may help, but understanding that that's what it is helps you to understand, well, what have I been going through that has caused this burnout, rather than what have I been going through that's made me depressed. And the burnout is more of like a physical cognitive thing, whereas depression is more of a mood thing. Does that make sense?
He said yes.
Okay. All right. Okay. But let me show you my trauma slide. This is what I'm really excited about, this piece, because I felt like I discovered it on my own from working with my own patients. But I noticed that a lot of my patients have trauma symptoms, PTSD type symptoms of avoidance of certain places and things, um, deep, like, negative beliefs about the world and the future, and things like this. And basically they'll tell me these stories of things they've been through in their life. And it's like, for example, one patient said, well, I was a tomboy and my mom made me wear these, like, scratchy dresses all the time because she wanted me to be a girly girl. And that was that was quite traumatic for her. It was, the invalidation, the fabric, the sensory experience was traumatic. Whereas someone who didn't have so many sensory issues, and, who's a less sensitive person, it may not bother them as much. The so the once again, the sensory is a big part of why people with autism suffer so much, because it also ties into people not understanding them and everyone saying like, this is no big deal, get over it, why are you acting like this? So, and then another thing is that unpredictability. Other people, like neurotypical people, if the dates get changed or the times are changed, they really don't care. People with autism are extremely disturbed by this. The control issue, if people are not given choices, if they're forced into things, it's much more traumatic for a person with autism. This problem, the communication mismatch, in that people don't understand that the person on the spectrum is terrified because they may shut down. They don't know how to communicate what's going on. They may freeze, and then people will, they'll have to have some medical procedure done that they're just absolutely terrified, but they're just hold their breath and then they're suffering through the whole thing. The prior accumulation, once again, these kind of sort of almost, when you think about if the person is so terrified, it's almost abuse. Even if it's a typical medical procedure like a blood draw, if they're terrified, you have to take into account that this is a different nervous system, and it's very important to validate how they're feeling and give them a choice, and make it a choice that where they can explain to them why the blood draw is needed, how it will help them, and then allow them to, and they may need a little more time to process what they're going through there. And once again, this comfort, the sensory issues, with the ways to help them, their nervous system react. And it was interesting. A study found that in terms of the re-experiencing of trauma symptoms, the neurotypical or the regular description of PTSD is that people will have these visual flashbacks by some locations. They'll avoid certain locations, things like that. And for people on the autism spectrum, it's very big about the sensory memory. So if this like things like the alcohol swab smell, the paper, the latex glove, the beeping machines can be extremely noxious to them. And this is a slide about that, so you guys can kind of visualize that. Here's this autistic young man, and all the other kids are just fine, just talking to each other and going about their business, and he's sitting there suffering. The conversations, the scraping noises, the smells, the glares, the temperature, the people brushing into him, the itchy clothing, crowds, perfume, bells ringing. It's like hell for him. All right. Okay. And now I'll tell you about a couple of my case studies. So this case number one is one of my favorite patients. She's really awesome. I really love working with my patients on the autism spectrum. I tend to kind of naturally understand them and really enjoy their kind of special talents. And, I just enjoy diversity, as I said before, and really value unique perceptions and behaviors. So this young woman came to see me back at 22, and she had been having problems all her life. Her mother was an alcoholic and was kind of verbally abusive, which was, and this is an example where because she was so sensitive, it intensified the trauma from that experience. And then in middle school, she was just extremely socially awkward. And as a consequence was, called emo and excluded from things. She went to, and then during the pandemic, though, she made friends online. And you do see this a lot, that people on the spectrum do really well with online friendships. I think they have more control there. They understand the kind of back and forth better. So she had made friends online. She went to high school, but she was just, when I saw her in 22, just severely depressed, severely anxious. She thought she had autism and ADHD, and I checked her for all the criteria, the REC rinse that I talked about earlier, and she met criteria. She had multiple symptoms. Let's see here. Tell you a little bit more about her. She had been self-harming, and her mother discovered that. She did start seeing a therapist, and this had been extremely helpful, but she still was depressed and anxious and wanted to go further. She was extremely stressed by social situations. She did not like to eat in front of people, and so she wouldn't eat at school. On multiple occasions, she had begun crying in the middle of class, and she always felt like people were talking about her, and she'd burst into tears. If someone raised their voice to her, she would feel extremely stressed and start crying. She also complained of trouble focusing. She had her own special interests. She reported trouble with eye contact, a general feeling like she didn't belong. And this is really common to see in autism spectrum. And one of the old websites that was helpful was called wrongplanet.net. A lot of people feel like they just don't belong here. And that's a common thing that they report. But we started treatment. We tried different meds, eventually found things that really helped her. And high school was difficult, but she did make a few close friends, and she's now in college and doing well there, though she still suffers with extreme social anxiety and has a really hard time in the cafeteria. So it's really an ongoing situation. But she's it's a little complicated because of her experience of early childhood trauma that can really affect your whole life experience, because when you're young, your nervous system is kind of trained to expect something bad to happen and kind of think the world is not that safe, and so you tend to continue to perceive that. But it was an excellent example of how treatment has been successful. My next case is also one of my other favorite patients, and I saw him in his early 20s, and he came to me and said, I think I have autism. He said everyone always tells him that he has autism. He's really a super smart guy and has his special interests. As a child, it was South Korea, and now it's geography and travel. But the main complaint that he has, the most destructive thing to his life and that he wanted to change, were his meltdowns. And these would occur, basically the pressure would kind of build up over time of his academic assignments and maybe issues with his family or planning things or something in his environment. And then some minor thing might happen. And he said one time had just been it was just a traffic jam, and he was in traffic for a long time. And he would bang. He started banging on the dash, screaming. And the other thing that he did was slap himself in the head. And he'd been slapping himself in the head for years. He would try to hide it from people, but that was what he did. And it's kind of an movement kind of releases the trauma. So by this kind of self-harm behaviors, people find some release, but it's not healthy at all. So it's like if he could be redirected to other ways of releasing that pent-up stress. And he describes it as being overwhelmed and agitated. And it's kind of a cousin of the autistic burnout. It seems like meltdown and burnout are kind of caused by the same things, which is kind of this like ever building pressure where their mind is just overwhelmed and they can't take it anymore. One of his triggers is procrastinating, not getting his work done until the last minute. He'll throw things, punch holes in the wall, throw cups and have broken them. He has this long-term problem with eye contact. He looked at people's mouths. People have told him that his eye contact is not normal. He reported he likes to flap his arms when he runs downstairs and had been doing that all his life. He gets very anxious if things change. If he goes on vacation to a new city, he feels anxious. And I've had to prescribe him medicine for his various vacations that he's been going on to conferences and things. And for instance, as a child, he would only go out to dinner, or he always went out to dinner every Thursday with his parents. And if that didn't happen, he would go into this state of being completely overwhelmed and, just irritated and upset. People would tell him that he goes on and on about certain topics. Some of his sensory issues is any kind of scratchy sound will kind of drive him up the wall. As a child, he had to wear specific socks, but he says he's now outgrown that. And he used to be terrified by the fire alarm. So we've been working together now for a couple of years. He's also progressing, and medication has been very helpful for him. And the meltdowns have greatly decreased. And he admits at times that, yes, I did slap myself, but it's really progress that he's open with me about it, and it's greatly, greatly decreased. And he's learned, like, he's able to describe these triggers and try to intervene before it gets too intense to where he will have a meltdown. Okay. So and then my last piece is going to be kind of a little test or guessing game. And I was just going to see if you guys had any questions on the presentation before we go into that.
Yes, actually, Justin has a really great question. I think Justin's like some superhuman for asking that. But
Awesome.
basically, they asked, in case two, do you have any recommendations for how academic institutions can move beyond simply accommodating ASD students to creating an environment that actively prevents sensory or social overload to prevent the meltdown from, even igniting in the first place?
Great question. I agree. That's a super question, very visionary. And it's the kind of thing that, the work your organization is doing to kind of advance our society and make a better place for all of us. And so, and he's right. He's asking if we can just move beyond accommodations. So I do a lot of accommodation paperwork for people. And the things are, allow them to not be in fluorescent lighting, have a place where they have some privacy and aren't being distracted, basically understood, being treated with validation, not minimized when they're concerned about what's going on around things. And but that question is so correct, because a lot of these things that people on the spectrum need, we really all need. And we definitely can make the academic environment better for us all by listening to some of these things. So I would, and departments, universities have their departments on kind of inclusivity and things like that. So it'd be a good idea for them to basically change the academic environment, in some way to where it's less like prison-like, I think, where basically people are kind of shuttled in, and shuttled out, and like the individual preferences are not respected. So it's a challenge for schools, but at some schools, the technological universities, a lot of the people are already on the spectrum, and so they actually have sort of an informal relationship there, because since the administration and the professors have many of the same symptoms and understand that the environment will be more beneficial. And I think they have started doing these things at universities with lighting and sensory experiences, and it does really help. I have a lot of autistic patients who are also in the arts. It's really interesting. A lot of them are really expert in science, and a lot of them are really expert in the arts, and they'll also find sort of an understanding amongst their the group that they work with, and they kind of work together to, understand each other and set up systems that work better. A big thing is laying out instructions. Don't not assuming that people just understand what they're supposed to do. People on the spectrum are always asking for concrete instructions, and that really helps them a lot. So making things more plain for everyone.
Thank you so much. We also have another question.
Uh-huh.
Anonymous. It's from a student who is interested in psychiatric research, and she asks, with the overlap between autism and mental health conditions, how common is it for one condition to be overshadowed by symptoms of another? And this is relating to the underdiagnosis of mental health disorders in people with ASD.
Yes, good question. So, how common is it to be overshadowed? Yes, in clinical research, we have a very kind of strict system where people are not supposed to have active, ongoing conditions that will kind of muddy the picture. So if we're studying autism, if the person has depression, we have to show that it's not active. Or if they have anxiety, like I said before, many of the anxiety symptoms kind of map right onto the autism symptoms. But so it's kind of artificial because it really all flows together. And that's where they're working on the DSM-6. And I hear it's going to be more dimensional and less categorical, because that's one of the things that people really complain about, is that we're kind of putting people in categories when actually everything really is a spectrum. So a person may have this percent depression, this percent anxiety, this percent autism, and kind of viewing it from that light. So, and then in clinical practice, like I said before, it's they're not going to get diagnosed with autism by their family practice doctor. Now, in early childhood, the pediatricians and family medicine doctors do screen for signs of decreased eye contact, decreased social behavior, in order to get them into early intervention, which has been shown to make a tremendous difference. However, when people dealing with adolescents and adults do not check for it at all. So usually autism is missed, and it's often missed in females. They do present differently. They usually have somewhat improved social skills and maybe better at masking. And so a lot of women don't go diagnosed until they kind of figure it out for themselves in a way. And then a lot of people have come to me and they've been, studying know that they have the symptoms that meet criteria. But all right. Okay, well, I guess we're getting a little short on time, so we'll go through our fun game because we can get some interaction.
Sorry, I think there's one last question. It's like
okay.
Is that since you specialize in psychiatry and all, someone asked, is there any medicine to help autism to improve?
Yes, definitely. There has been much research into which medications help autism. These SSRIs, the selective serotonin reuptake inhibitors, have been found to decrease the obsessive repetitive behaviors, the rigidity, and it's also kind of an anxiety reducing effect. And that kind of helps them get through life. It can help quiet some of the sensory symptoms. The antipsychotics, such as Risperdal, are approved by the FDA for the treatment of irritability in autism. And I've definitely used Risperdal actually in young children who are at the higher levels. And, because autism can get extremely severe. And so you have to use a little heavier medicine to help keep them calm. And new medicines are coming out all the time. There's one called Abilify. That's sort of a newer generation antipsychotic that has been shown to help with autism as well. And I have a new study that we're doing for age 5 to 17. And there's a new drug called Cobenfy, which is the first new mechanism of action drug it's been approved for schizophrenia. but it's totally different from the older antipsychotics. They kind of have the older antipsychotics have a bad reputation for making people really super sleepy and kind of blunting them, maybe making them seem a little out of it. And so this new medication does not have that effect. It may actually help with those kind of social symptoms.
Thank you so much.
Yes.
Oh, okay, so we'll do our quiz here. Okay, so I'm going to give you some clues about a person who has stated in public or stated in their biography sometime in their life, self-reported that that they're on the autism spectrum in some way. Okay, so our first one. This is a person who started a school strike for climate action. She sailed across the Atlantic to avoid flying. She's described being different as a superpower, and she's known for very direct moral urgency, kind of cutting through a lot of the like superficial stuff and saying like, this really matters. Any idea who this is?
Someone asked Greta Thunberg.
Correct.
Oh, wow.
Good job. Yes. Okay. And now our next one. So that's a good example where her perspective, because she perhaps doesn't have the same idea of like wanting to fit in necessarily or being kind of led by what other people think. She has her kind of independent beliefs that help her see things differently. And that's the kind of um, benefit that we get from having so many different perspectives. The next one, connected with rockets, electric cars, satellite, tech companies, said on Saturday Night Live that he has Asperger's, has intense focus, risky projects, and I'm sure you guys know who this one is.
Probably the one and only Elon Musk.
Exactly, yes. He's pretty well known to be on the spectrum. Next, this is a comedian actor from Saturday Night Live. He helped create a movie about catching ghosts, and he talked about having Asperger's and Tourette's, and he has intense interests that helped him with his comedy. And this is from my generation. You guys don't know this one probably. That's Dan Aykroyd. I don't know if you know who that is. He's from Ghostbusters. This is probably she's a very famous person with autism. Everybody loves her. She's a genius in working with animals. She designed a special system for herding cattle to keep them comfortable. Like she was so in tune with animals and so obsessed with, understanding how they work. She felt like she understood their sensitivities and fears. Like she had similar issues. And she described herself and autism kind of as thinking in pictures. You guys know who she is?
You?
Oh,
Not me.
Temple Grandin.
Yes, good one. Yeah, she's awesome. She wrote a book called Thinking. I read her book. It's so interesting. She's very famous. Next, we have, if you're interested in autism, she's definitely one to read about. The next one, this is a singer-songwriter known for giant wigs, huge pop songs. She's written many songs. She talked about being on the spectrum herself. And it has, and this happens a lot, that a lot of people's anxiety goes down when they get their autism diagnosis, because it lasts, like they do feel validated and understood that their nervous system is different. Any idea who this is?
Cyndi Lauper?
Nope.
We have
Oh.
Dolly.
She's modern. She has big wigs.
Apple Row.
No.
Lady Gaga?
Nope. Like one half will be white, one half will be black. She never shows her face a lot.
Yeah.
Sia, yes.
Oh, wow.
Isn't that interesting? Yeah. These are all like really cool people, most of them. Most of them. Number 6 is an alternative rock musician, actor, was in the band Hole, 1990s grunge culture, and she was also diagnosed with autism. She's well known to have some really out there behavior. I actually saw her perform and she started like yelling at someone in the audience and like trying to fight somebody in the audience. She probably has some other diagnoses too. Guess who this one is?
Got Courtney Love.
Correct. Okay, number 7.
Oh, this one's by Pokemon. Wait,
Exactly. What's his name?
is the guy's name actually Pokemon, or does he have like a name?
No, that's not his name. It's it's. We'll see it at the end. Does anybody know?
Say something like say something something.
It's
S
Ayatoshi.
Aitoshi.
Ayatoshi. Yeah, so he's a famous person, just who perhaps he was upset. His special interest was collecting insects, and he was that's and that's an example where when love something so much, it can lead you to create great things.
But Pikachu and most Pokemon characters are based off of like animals.
Right. It sounds like probably he loved all animals. Maybe he started with insects and just became obsessed with animals as well.
Sweet.
Yeah. And this one is more you guys's generation. I can't remember I don't necessarily know this person, but she was in a hit post-apocalyptic series and fantasy series with dragons. And she also said she felt better, more free after getting her diagnosis. And this is an example, like I was saying, a lot of artists also have autism. And so she said because she didn't understand social skills naturally, by studying them and studying people, it actually helped her acting skills. Let's see. Bella somebody or other. We'll come to the answers here at the end. Number 9 is somebody who played an autistic character in Heartbreak High, wrote a book called Different Not Last, and has a platform to challenge autism stereotypes. Let's see. Here's our answers. 8 was Bella Ramsey, and 9 is Chloe Hayden. So all different kinds of people here. And the Pokemon is Satoshi Tajiri. And there's many others as well. It's really fun to study that because there's like all this stigma against mental illness, but being diagnosed with a mental illness does not mean that you're not going to be successful. In fact, a lot of very successful people suffer with mental illness at the same time.
Thank you so much, Dr.
Yes.
Johnson. We are